Bismillahirrahmanirrahim. Iyyaka na'budu wa iyyaka nasta'in. Allahumma salli ala Muhammadin wa ala ali Muhammadin wa barik salli alayhi. Dear colleague, this is a young male patient, almost 35-year age, with history of swelling at the right inguinal region. So suspecting the right inguinal hernia, I am going to scan the right inguinal region, uh, whether it is direct or indirect inguinal hernia. Last time I told you to follow the inferior epigastric artery from the umbilical region. So now I am going to tell you about another landmark that can be used to differentiate between the direct and indirect inguinal hernia. So I have placed the probe just below the umbilicus in midline, and this is the muscle which is rectus abdominis muscle. So in the midline below the umbilicus is the rectus abdominal muscle. I am now going to follow this rectus abdominis downward. This is the rectus abdominis muscle. This is the rectus abdominis muscle, and this bone is the pubic symphysis. This muscle is inserting into this area. This is the pubic symphysis. This one. So I started from the umbilical region in the midline, follow midline downward, and I reaches the pubic symphysis following this rectus abdominis muscle. So when I reach to the pubic symphysis, then I just move slightly laterally. So now I have reached laterally to appreciate the pubic tubercle. Only 1 centimeter laterally. Then I turn the probe toward the right superior iliac spine. ठीक ना? When I turn the probe toward the right superior iliac spine, then this I have just laterally moved so that this pubic tubercle should be hardly visible. Then I have reached the point where the superficial inguinal ring is present. This is the superficial inguinal ring through which the cord or the round ligament passes into the groin region or into the scrotum. Spermatic cord for the male, round ligament for the female. So I have measured this. It is 9 millimeter, 9.4 millimeter. So it is larger than the normal, or there should be almost below 6 millimeter. So this is larger. The superficial inguinal length. Why it is larger? This thing, if you appreciate, this is the structure which is passing. This is the anterior wall. This is the posterior wall of the inguinal canal, and there is a structure within the inguinal canal. This is passing through this superficial inguinal ring. So again I am going to show you. This is the pubic tubercle in screen. This one laterally move, turn the probe toward the right superior iliac, and then we can appreciate the inguinal canal. This is the anterior boundary, this is the posterior boundary, and this is the superficial inguinal ring. And this structure, which is definitely herniated segment, is passing through the superficial canal. So this superficial inguinal ring, this one, and here is the conjoint tendon, which become weak when the direct hernia occurs. This conjoint tendon become weak, so this is the abdomen, which is not visualized due to the deeper structure. So this from the here this is the point, this is the superficial inguinal ring. So here this is the point where this hernia project from the abdomen into the anterior abdominal wall, and the herniated segment move upward like a bomb blast. These not move into the inguinal canal, these move upward. This all area is the Hazelbach canal, the triangle of Hazelbach. I will tell you later on. So this is the point, this is the superficial inguinal ring. So I am now going towards slightly laterally. This is the herniated segment, slightly laterally. This is the inguinal canal, and this is the herniated segment. This one, this one, this one. Now these are the femoral vessels, which are lying lateral to the inguinal, this hernia, lateral to, and this is the point, this one is the point, deep inguinal ring, from where this herniated segment is projecting out. This one, this is the, and this is the inferior epigastric artery that is pushed medially due to this herniated segment. So this is the deep inguinal ring through which this hernia has been. This is the herniated segment. I have placed the probe in transverse direction, just make it round, otherwise this is the longitudinal direction, and we can appreciate this herniated segment. This is the anterior wall, this is the posterior wall, and here is the defect. Through which this herniated segment has been projected, and this is the area of deep inguinal ring. This is the neck of the femur, measurement 11.5 millimeter. Here I can again tell you, this is the herniated segment projecting outward. This is the deep inguinal ring. This is the lateral side, and this is the medial side. And this is the inferior epigastric artery that it pushed medially due to this herniated segment. And this herniated segment is lying lateral to this right inferior epigastric artery, as this is the right inguinal region. So this was all about the right indirect inguinal hernia, how to differentiate, and what is the another criteria to detect the inguinal hernia, whether it is indirect and or direct inguinal hernia. Thank you very much.